Thyroid overactivity has a variety of different names, sometimes called thyrotoxicosis or hyperthyroidism, but it all means essentially the same, and it's caused by the thyroid gland making too many thyroid hormones.
Well, I was very hyperactive, which I didn't realise. Because I had 4 children very close together, I wasn't working then. I was when I had my diagnosis, but before that, so I was always busy.
This condition can affect anyone, really across the age spectrum, but it's rare in children before the age of about 10 or 11. It's most common in women, actually by a ratio of about 4 or 5 to 1.
It's a lot less men. I mean, thyroid problems to start with are a lot less prevalent in men.
What you find in thyroid overactivity is that the thyroid hormones in the blood are elevated. That's both the total thyroxine and the T3, which is the active thyroid hormone. So both those are generally raised in thyroid overactivity. And then the TSH, thyroid stimulating hormone, which is the brain's message to the thyroid gland telling it what to do. The brain is telling the thyroid gland, don't produce any more hormone, there's far too much going around. And so the TSH level in the blood becomes undetectable, whereas in a healthy person it's normally detectable. So that's, if you like, the hallmark of hyperthyroidism from a blood test perspective, and those tests are incredibly accurate.
So we went to the doctors where I learnt that I had a very severe overactive thyroid and I needed to be put onto treatment straight away.
The most common symptoms are weight loss, increased appetite, feeling very hot or sweaty, a racing heart, people feel like their heart sometimes is pumping out of their chest, and shakiness of the hands, tremors, anxiety.
Your blood pressure obviously goes sky high, your pulse races, you are active, but then you sort of, because you're so active and rushing about and being able to do so many jobs, then you do feel very tired as well.
It's commoner in smokers, it's commoner in ladies who have been pregnant, and it's probably more common in people who have undergone stressful events in their life as well.
Which is what one school of thought is that a severe shock to the system, like I suppose a sudden bereavement of a very close relative could do the same thing. But when you can see your business being destroyed in a massive storm before your very eyes, it just obviously must hit you deep down and could quite possibly trigger something off.
Thyroid scanning can also be used, and in thyroid overactivity, probably the first scan we'd go for is a nuclide scan, which is where you have an injection of a small amount of tracer radioactivity, and then that gets taken up by the thyroid. And if you have nodules in the thyroid gland causing overactivity, you see this particular patchy pattern of uptake, which tells you that some nodules are really very overactive and other areas of the thyroid are asleep.
I went to see the consultant, and he said he had a quiet day, which is how it turned out. And he said, we'll do a scan.
The commonest cause is caused by an autoimmune attack on the thyroid gland by the body's immune system, and that's known as Graves' disease, and that accounts for around about 70% of all cases of thyroid overactivity. And that's the one that's particularly common in women as compared to men.
Part of the struggle I had throughout my journey was I didn't have cancer, I didn't have a well-recognised disease or a condition that was really deadly, but I still had a condition where my body was under immense pressure, quite dangerously so.
Around about 30 to 40% of people with Graves' thyroid overactivity will develop thyroid eye disease, and that can be as mild in symptoms as just having gritty eyes or a little bit of white above the eye, more than usual visible, so a slightly staring appearance.
And my eye started to protrude slightly as well. So I started to unfortunately experience those side effects, and for 18 months I was just always back at the hospital, always having blood tests.
The eyelids can become swollen or red, and the eyes themselves can become red. After that, in severity terms, the next thing to happen would be the person will develop double vision. Either just on looking from side to side, but sometimes also when looking straight on, so that makes reading very difficult. And then lastly, occasionally people can actually have the sight of their eyes diminished. The visual acuity starts to be lost if the optic nerve behind the eye becomes compressed.
So what happens is that it becomes proptose and pushes the eye out of the head as such. And of course, if the severest case, of course, the optic nerve would break and you go totally blind.
They can have quite good surgery for that now, which is once again orbital decompression surgery, allowing the eye to drop back a bit if it's particularly protuberant, and that can be coupled with surgery to realign the eyes, squint surgery on the eye muscles, and then the last thing is eyelid surgery. So some people will undergo a series of 3 or 4 operations in quite quick succession to get their eyes in a good position relative to the face.
Normally they cut along the smile lines, which they did with me, and as I put my finger there I can feel a tingling of where the incision was made, and also here, and then the face mask is taken down and up to free off space around the eyes so the surgeon can get access to all this material and carefully extract the mucous material and make more space. In the case of my surgery, they also took some bone away as well to make the actual orbit slightly larger.
For Graves' disease, one of the most common treatments is medication with antithyroid drugs. That means either carbimazole or propylthiouracil. I think it's now fairly well established that carbimazole is safer than propylthiouracil. There's a very low risk of liver damage, about 1 in 10,000 people who take propylthiouracil.
All they were doing every time I went back was just basically increasing that dosage daily, ever so slightly more, as a way of trying to get the thyroid gland to be more under control.
So people treated with drugs will generally be treated for 12 to 18 months with the drugs, and in Graves' disease, if we stop the drugs after that period, there's a chance the thyroid has put itself right, and then the person can stop medication and be in remission, which cannot be forever or for very many years in some people. There's a chance that the thyroid overactivity will come back, and that chance is greater in the year after you stop the medication.
A lot of people have an overactive thyroid and it's treated and it's fine. It goes back to normal and everything's fine. Or they may have partial removal of the thyroid that just calms it down, so you've just less production there in the thyroid still in the patient's body.
Surgery is a different option. Surgery is particularly suited for people with really large thyroids because obviously the appearance of the thyroid can be concerning or disfiguring to the person, so they quite like to get that removed. But in as far as the need for thyroxine tablets after the treatment it's pretty much the same as radioiodine.
My thyroid was just not behaving itself. It was so overactive. I was now on the highest dosage that anybody could give me. So the option was there to either have surgery to remove my thyroid gland or to have the radioactive iodine treatment, which is the option that I went for.
So radioiodine gradually destroys the thyroid cells over about 6 weeks to around about 6 months in most people. So you don't know it's happening gradually, and over that period of time people will have a regular blood test, perhaps every 2 or 3 months, to just check they're not going underactive.
I had to sit behind a screen, drink this liquid, which took about 3 or 4 seconds even, and that was it.
Radioiodine does make your body mildly radioactive for 7 to 10 days, depending on the dose, sometimes a bit longer. And so you should avoid sharing a bed with anyone or being in close contact with them, which generally means more than arm's length or closer than a metre.
I remember them saying this treatment doesn't always kill a thyroid gland, it might just slowly deteriorate over time, which is what it did. So it actually took about 15 to 18 months to actually stop working altogether.
We'd recommend that almost everyone with thyroid overactivity got seen by an endocrinologist, and that's important really to make a definitive diagnosis of what the problem is. Although in most cases it will be Graves' disease, your GP is probably not in the best position to differentiate Graves' disease from thyroid nodules or from thyroid inflammation, thyroiditis, so seeing an endocrinologist will allow the relevant tests to be made to allow a firm diagnosis and treatment plan to be agreed.
People along the way helped me, and then of course I got to know some very good consultants, and some of those consultants are now very good personal friends, as well as medics who I respect, for their knowledge and the way they've helped me.